I said last week that there was a first glimmer of good news with the expected arrival of the first small shipment of vaccines this week. Today, I'm here to confirm that the news is a lot bigger and it's a lot better. That first shipment of 3,900 doses of the Pfizer BioNTech COVID-19 vaccine arrived today. And it's been safely stored at the designated sites in Calgary and in Edmonton. We're taking the final steps to prepare, including hands-on training of staff to start immunizing healthcare professionals on Wednesday. As announced, we'll begin immunizing ICU doctors and nurses, respiratory therapists, and eligible continuing care staff in Edmonton and in Calgary. Now, we chose these cities because that's where our case numbers are the highest and where our health system is facing the greatest challenges in terms of capacity. And we're going to give the system some real help in dealing with those challenges. Because this month, we're not just doing these first 3,900 doses. I'm pleased to announce that we expect to receive another 25,350 doses of the Pfizer vaccine next week. That's about 29,000 doses, and they can all be first doses. We don't have to hold back any of that portion for the second dose. We're going to give the first dose of vaccine to 29,000 healthcare professionals by the end of December. Making this announcement is the greatest privilege that I've had as health minister, because it's the first real ray of light in the dark night that our healthcare professionals have lived through for 10 months now.
These are new vaccines, and so we need to ensure that Alberta Health Services staff have the specific training outlined by Pfizer for the safe handling and the administration of those vaccines. These first doses are being stored in ultra-cold freezers here in Edmonton and in Calgary. However, we are ready to start receiving them province-wide next week when the second shipment arrives. Alberta Health Services has already received and installed ultra-cold freezers at 8 locations to store the Pfizer vaccine, and we have confirmed dry ice shipments for Alberta Health Services as well. We have 8 more cold storage units arriving before the end of December, and an additional 20 scheduled to arrive in January. To prepare for the Moderna vaccine that Minister Shandro mentioned, 7 units are expected by the end of December, and an additional 16 will arrive in January. Alberta Health Services has all the other supplies needed to administer these vaccine doses for several months, so we are well positioned to ensure vaccinations go smoothly. If more vaccine becomes available, arrives earlier than expected, we will, as I like to say, be ready to roll. Alberta Health Services public health and workplace health and safety nurses will administer the early vaccine doses. And we are building on the success of the United Kingdom vaccine rollout and using their materials as a starting point for planning, in addition to all the training materials and information that we are receiving from the companies that manufacture the vaccines. We are truly, truly well prepared. Albertans can be confident that this vaccine is safe and that it will be administered efficiently without compromising quality. We have a dedicated multidisciplinary team from Alberta Health Services, Alberta Health, and the COVID-19 Task Force. And we are all committed to getting the COVID-19 vaccine to our healthcare professionals and the most vulnerable Albertans as soon as possible.
Vaccination will be offered to all but will not be required. So healthcare workers who do not wish to receive vaccine, it's their choice and there will be no sanctions against them.